Dr. Aulo, over to you. If you can share your screen, please.
Wonderful. Thank you very much, Namukolo. Good morning, good afternoon, everyone. I hope you can see my screen. It's an honor to be part of this panel talking about women in agriculture. I'm a nutrition epidemiologist, but for the next 7.5 minutes, I'll talk about something that has come up continuously in the studies that I've been working on, which is really looking at how women interact with policies and programs, and in particular, an aspect of equity linked to women's time. So I'll present findings of my work with a particular focus on equity and the use of time. And why is time important? Keeping track of women's time is important in many different facets of this very broad agenda that we will be discussing today. So nutrition-sensitive programs have the potential, as we know, to accelerate progress in tackling maternal and child malnutrition. These programs often have a very strong behavior change component, particularly focusing on changing behaviors of caregivers of children. So interventions that look at shaping education or infant and child feeding practices, caregiving practices, agricultural practices, water and sanitation and hygiene practices, and really the list goes on. These multisectoral programs really have, which is one advantage of them, have these very broad-based strategies, but at the same time, they kind of channel a lot of information and a lot of activities around behavior change of caregivers. So on the one hand, they potentially could have important benefits, but on the other hand, they could also make the day-to-day work of women in particular harder than they are already. And the more I worked on this study, on these topics, the more it was clear that there was really an important need to generate rigorous evidence on how these interventions affected women's time use and whether the time burden in turn affects both women's well-being, but that of their children too. So in the next few slides, I'll present some rigorous evidence from mixed methods work that we've been doing on women's time use in Burkina Faso, Malawi, and Mali. And this is all in the context of impact evaluations that really had nutrition or related health goals as the primary outcomes. But women's time really came in so many different sides and really helped to shape the pathways through which interventions achieve those goals. And it became quite central, actually, quite quickly in the different contexts. So the first study I'll talk about is set in Burkina Faso. It's the Syllabus study, and this is joint work with Jessica Heckert, Sarah Eisler, Armand Sanou, and a team of very able researchers based in both Burkina Faso and Washington, D.C. And this is based on a cluster randomized trial of a value chain and nutrition intervention, including approximately 1,800 households across 3 regions in Burkina Faso. In terms of preview of the main results, we found a non-result at household level in terms of many of the poultry-related outcomes. But what we did find was meaningful and substantive benefits of the intervention on women, in particular in terms of their poultry production, their sales, and their revenue. At the same time, we found no changes in women's empowerment overall and no changes in work balance, particularly both in the lean season and in the N9 survey. However, in the qualitative work that we were doing, we tried to unpack some of these findings and tried to get a handle of the program and how it interacted with some of the different cultural environments it was set in, and particularly comparing polygynous and monogamous households. And we found that in polygynous households, particularly when co-wives maintained good relationships with one another, they had an easier time than monogamous households in rebalancing workloads as labor demands increased. For example, one co-wife could look after children and prepare meals when another agricultural load was too heavy to handle. In contrast, in polygynous households, men often made decisions completely on their own without consulting their wives, while men in monogamous households more often than not discussed important decisions with their wives. So the interpretation of no change related to women's time use in this particular context with regards to work balance can likely be interpreted positively, as there was no increased time burden in the treatment arms. However, the qualitative work suggested that at least in some households, additional workload might be spilling over to children and adolescents in the household, especially girls, which is an important aspect for continued work going ahead, and one that I'll pick up in a later study. The second study I'll talk about focuses on Malawi, and this is the NIPI study, building on work by Amy Margolis. The study here is set on generating experimental rigorous evidence on using preschools or community-based childcare centers as platform for scaling up nutrition behavior change. And the study is set in southern Malawi in Zomba district, where we had 3 rounds of surveys covering approximately 1,200 households, and we couple that with in-depth interviews of program participants. So the randomized trial found large benefits to children in terms of both their diets and their linear growth and their child development. At the same time, what we found that the intervention, which really relied on providing information to caregivers, did not add specific time burden across the whole trial. However, at specific time points, particularly in the lean season, we found that the intervention added approximately 30 minutes of extra caregiving time compared to the control group. So when probing these results in a qualitative setting, in in-depth interviews, we found that the program-related tasks were not considered burdensome by the women participating in the study. In fact, the participants viewed the contributions as important investments in their child's development. So although the program caused a modest increase in time spent in caregiving, particularly during the lean season, this additional time was considered well spent. And these findings provide the first evidence that we know of on whether women's participation in a nutrition-sensitive agriculture program added to the burden of care. The last study I'll talk to you about really focuses on sort of an earlier sort of life cycle stage and really looks at a program focusing on school meals in Mali, building on work by Elisabeth Taurino at Imperial College at the Partnership for Child Development. So this study is a quasi-experiment, and it was set up to examine the effectiveness of providing school meals on girls' education in rural conflict settings in central Mali, building on 2 rounds of survey data in the Mopti region, covering approximately 1,200 households over a 5-year period. What we found that the benefits of changing the way girls' time use operated and shifted from work-related activities to schooling because of the school feeding intervention, had very important benefits in terms of access to school and grade attainment. So over the period of 5 years, girls receiving school meals were able to increase their grade attainment by approximately half a school year, which in those contexts of where schooling is already a challenge in a conflict related setting is pretty meaningful. What we also found, though, that general food distribution, another way of distributing food assistance, did the opposite. It increased labor-related activities, particularly for boys. So in conclusion, I hope through these snapshots of programs in the field, I've been able to illustrate to you how keeping track of time use is an important component of these programs, and keeping track of time use can improve intervention design, check or validate assumptions on how interventions work, and avoid potential unintended consequences that could exacerbate existing inequalities. Thank you very much.